Okay, so now this appointed patient here under this doctor will be found in this doctor appointment list when he will log into EMR, that is electronic medical record, to give consultation to his patients. He will log into EMR using his given credentials, which is what I'm showing now. Logging to EMR. Okay, so as said, here you can see the list of appointed patients for consultation under this doctor according to this given date range. Here you can see my patient. First I am going to nurse station. Here is my patient, so I'm first going to mark her arrive in the nurse station. Then I'm going to take her vital signs. Here taking her vital sign now. Giving here height, weight. Okay, so save this data. Okay, so vital sign has been taken, and from here you can also edit the data and update the vital sign. Now going to service station, check on this option to arrive this patient in the service station. Enter this patient into the doctor room. Okay, so this patient has been entered in the doctor room. Now going to doctor consultation, appointed patient. Here is my patient. Click on this patient name to enter into this patient profile to give her consultation. Okay, so here you can see the vital signs which I have just collected, the patient information. Click on this option to give a chief complaint for this patient. Giving here chest pain, then save this information. Here information has been saved. Now going to give this patient a quick consultation. First I am going to assign her some investigations that she needs to undergo. Save this on information. Here you can see the list of investigations which I have just added for this patient. You can edit or delete any investigation as per needed. Save this information. Here the investigations for this patient has been saved. Now going to give her some medications. Writing here the medicine name. Okay, select from this list of values how this medicine needs to be taken. I'm selecting here by mouth. From here select how this medicine needs to be taken, and that is if any specific instruction that needs to be followed for this medicine. Write here the dose per take, frequency, duration, and the duration type, that is how it needs to be taken. I am selecting here days. Add this medicine. My prescribed medicine has been added here. Similarly you can edit or delete this medicine as per needed. I am giving here another medicine. Similarly as before, I am here adding some instructions: the dose per take, frequency, duration, and the duration type. Add this medicine. So here you can see the two medicines that I have just recently added for this patient. Click prescribe, and here you can see that my prescribed medicine for this patient has been shown here. Okay, so now I'm going to give some advice for this patient. Here you can see that there are 4 options of how advice can be given to a patient. First, their follow-up visit, request for OR, refer this patient to a different doctor, or you can send request for IPD admission from this option. So first I'm going to show you the follow-up visit. Here write a reason for the visit. Click on any of this option if a consultation fee needs to be taken for the follow-up visit. Then write here any specific description that needs to be followed or undertaken during this follow-up visit. Then select from drop down list the visit time, and based on your selection, system will generate a time slot for this consultation. Then save this information by click on this option. Moving on to request for OR, you can search for the surgery by from list of values. Here you can see that the surgery name and the surgeon who will conduct this surgery has been generated from system. Right here in if any specific description that needs to be followed for this surgery. Select any priority from list of values for this surgery. Select the surgery date and admission date from calendar option. Then click on this option to save this information. Use this option to refer this patient to a different doctor. Write here a reason for the referral. Write here any description that needs to be followed for this referred reason. Click on either option if any fee needs to be taken for this referred portion. Select from drop down list of when this visit needs to be undertaken, and based on it visit date will be generated from system. After you have finished specifying the visit date, then save this information. Moving on to IPD admission. Here you can see that this portion has been divided into 3 sections. That first one is patient information, and this one is the registered information and has been generated here through system. Second is the admission data that needs to be filled up during admission process, such as from where this admission is being taken, then who is the admitting consultant, if any admitting diagnosis is there for the patient, then any proposed date of admission, then what is the specialty or service that this patient needs to be admitted under, then in which ward this patient is being admitted to, and how long he or she has to stay here. All this information will be filled up under this portion. Okay, so this portion is for any specific admitting information or instructions that needs to be followed when this patient is being admitted to IPD, such as the patient's condition, then his mobility status, if he or she is following any specific diet, then what is the nature of the diet, any specific investigations that needs to be taken or treatment, or any specific procedures that needs to be followed. Save all this information in this section. Then after you have finished all this filling up data, then click on this option and a request for this admission will be sent to IPD. So now moving to instruction. Click on this option to give patient any specific instructions such as any nutrition information. Here I am giving an instruction. Then any specific activities he or she needs to be followed, or any special care this patient needs to be undertaken. So below here you can see all the saved data that I have just entered for this patient, such as the vital sign, patient information, the investigations that this patient needs to undergo, the medicines he needs to be taken, and instruction that this patient needs to take. Okay, so from here you can also update the vital sign of the patient. Here you can see the previous vital sign, who has taken the vital sign for this patient and when this vital information has been taken. Also you can see the graphical in the representation of the vital sign information, such as the line chart or bar chart. Click on this option to print the prescription, and here you can see a preview of the prescription. So overall here is the patient information, the chief complaint for this patient, appointment information, the vital signs of this patient, the investigations that this patient has been assigned to undertake, the medicines that this patient needs to follow as a new and instruction, and who has prescribed this consultation. Click on this option to print the prescription. Okay, so now I am done consulting this patient. Copying here the consultation number for further reference. Close this option. Then go to appointment list. Click on this option to move this patient out of the doctor room. And that is my end in consulting this patient.